Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. Salam sejahtera, salam sihat keluarga Malaysia. Yang Berusaha Profesor Dr. Chan Siu Ping, President of the Malaysian Osteoporosis Society. Yang Berusaha Dr. Yip Swan Sim, Chairperson Clinical Practice Guideline for Osteoporosis 2022 Task Force. Executive Committee members of the Malaysian Osteoporosis Society, members of the media, ladies and gentlemen. In 2020, Malaysian women and men were found to have a life expectancy at birth of 78.5 years and 74.4 years respectively. Yes, we live longer thanks to the improved healthcare and higher living standards. In fact, according to the World Bank, we are already an aging society with 7% of our population aged 65 years and over since 2020. This group is projected to triple from 2 million in 2022 to over 6 million by 2040. As more Malaysians grow older and live longer, many will likely suffer age-related non-communicable diseases such as osteoporosis. Ladies and gentlemen, osteoporosis occurs when bone density is severely reduced. This disease results in bone fracture, commonly affecting the spine, hip, or wrist. These are more common than often thought. A 2021 study showed that 11.4% of approximately 1 in 10 people over the age of 45 in an urban population had asymptomatic vertebral fractures, a possible precursor to osteoporosis. A 1997 study revealed that 90 people out of 100,000 over 50 had suffered a hip fracture. For most of them, the outcome would be bleak. A study in 2020 found that upon discharge from the hospital, all needed walking aids. 6 months later, only 24% or 1 in 4 regained mobility and independence. Sadly, another 26% or 1 in 4 died within 1 year after the fracture. All osteoporotic fractures are associated with disability and premature death. This is especially so with hip fractures, projected to increase from 5,880 in 2018 to 20,893 in 2050, a 3.6-fold increase. Osteoporosis is a serious disease that requires early detection, intervention, and management, even at later stages. Thus, I congratulate the Malaysian Osteoporosis Society for supporting these needs by developing its 2022 Clinical Practice Guidelines, or CPGs, for the management of osteoporosis. As osteoporosis can present to different medical specialties, I applaud the Society for assembling a diverse panel of authors, including primary care physicians and endocrinologists to geriatricians and surgeons. Together, these experts have provided the latest evidence-based options for osteoporosis assessment, diagnosis, and treatment. Investing in primary healthcare systems has demonstrated overall improvement in healthcare delivery across the globe. Thus, it is commendable that the CPG recommends how one's risk level can be assessed at the government health clinics and general practitioners' clinic. If patients are at risk, the CPG provides further assessment, diagnosis, and intervention information. If osteoporosis is present, there is guidance on the course of action to be taken, including when to initiate treatment, what medications are available in Malaysia, and which medications to prescribe under different situations. These are encouraged to prevent even the first fracture. This is crucial because once you have had one fragility fracture, you will likely experience another. For this reason, I urge healthcare professionals to utilize the CPG to make crucial and timely clinical decisions. Initiating best practices will improve the lives of their aging patients and help reduce the burden of osteoporosis that is expected to rise in the not too distant future. Ladies and gentlemen, recently the government introduced a health white paper which looks forward to the future of healthcare in Malaysia. The ultimate goal should be to ensure that all Malaysians can live long and healthy lives no matter who they are or how old they are. Hence, maintaining strong bones and reducing fractures is crucial in making healthy aging a reality. As such, in addition to the comprehensive guidance and treatment of osteoporosis, I am pleased to note that the CPG has sections on the prevention of osteoporosis. In particular, the CPG contains relevant vital sections, including, first, prevention of osteoporosis and bone loss. Second, assessment of falls risk, as many fractures would not occur if the older patient does not fall. Third, calcium and vitamin D. Fourth, exercise. And lastly, fifth, avoiding smoking and alcohol to help in preventing bone loss and falls. These are practical and important everyday considerations that warrant repeating. As bone is constantly being broken down and rebuilt, older persons must ensure adequate calcium intake from their diet or supplementation. Vitamin D, which is mainly made by the skin when exposed to sunlight, is crucial for calcium absorption. Despite living in the tropical countries, many Malaysians do not have adequate vitamin D levels, even with sunlight exposure, and may require vitamin D supplementation. Weight-bearing exercises such as climbing stairs, walking, jogging, tai chi, dancing, and sports are encouraged to improve bone density. One of the critical initiatives of the Ministry of Health Malaysia is to stop smoking altogether. Tobacco smoking is not just bad for your heart and lungs, but also for your bones. As compared with non-smokers, current smokers have a 25% increased risk of fracture and a 60% higher risk of hip fracture even after adjusting for other risk factors. Therefore, stop smoking will also improve bone health. When looking at the distribution between gender, women tend to lose bone mass faster. It forms when menopause sets in, whereas men tend to lose bone mass at a slower rate. However, by the age of 65 or 70, both men and women will lose bone mass at the same rate. So regardless of the gender, osteoporosis may become a threat to all of us as we age. We must adopt preventive lifestyle practices, assessing our risks, and complying with the treatment to overcome the disease and attain our aspiration of aging healthily. Before I end, once again, I congratulate the Malaysian Osteoporosis Society, and I'm pleased to launch the third clinical practice guidelines for the management of osteoporosis. With that, ladies and gentlemen, I thank you for your attention.